Hello, everyone. My name is Lauren Collins. I'm the director of the Office of School COVID Support, and I want to welcome you to the New York State Department of Health's webinar titled School COVID-19 Reporting for the 2022-2023 Academic Year. Today's presentation will provide an overview of COVID-19 related reporting requirements for schools during the 2022-2023 academic school year. You will hear from three members of our Education and Technical Assistance team, Gina Galuli, Bella Mazzetti, and Christine Wynn. We will provide information about the status of the school report card before discussing limited service laboratories and communicable disease reporting. Then we will briefly go over information about outbreaks and share some frequently asked questions relating to school-related COVID-19 reporting. At the conclusion of the presentation, a slide including pertinent web addresses that highlight key items discussed today will be shared. And now I'm going to hand things over to Gina to discuss the school report card.
Thank you, Lauren. First, let us address the school report card. Schools are no longer required to report COVID-19 testing and case positive data to the New York State Department of Health school report card via the daily survey, as this requirement ended on June 30th of this year. Any school conducting testing under an LSL, or Limited Service Laboratory, is considered to be a lab and must report positive test results if performing COVID-19 testing using waived COVID-19 rapid antigen and rapid molecular tests. Laboratory results are reported via the Electronic Clinical Laboratory Reporting System, or ECLAIRS. Please note that an active LSL registration would be required for over-the-counter at-home test use if someone other than the person being tested, for example, a school staff person or employee health personnel, performs the test for the person and/or interprets and reports the test results. For technical questions on how to report results, please contact 866-325-7743 or eclairs@health.state.ny.us. Regardless of LSL status, COVID-19 is on the list of reportable diseases that schools must report to their local Department of Health pursuant to Education Law, Section 906, Public Health Law, Section 2101, and 10 NYCRR Section 2.12. Sections 2.10 and 2.12 of Title 10 require physicians, head of private household, or the person in charge of any institution, school, hotel, boarding house, camp or vessel, or any public health nurse, or any other person having knowledge of an individual affected with any disease presumably communicable to report immediately the name and address of such person to the city, county, or district health officer. Schools must report presumptive and confirmed cases to their local health department. This information helps local health departments monitor spread and informs public health strategies. Local health departments can mitigate disease spread by understanding where and when cases occur, which is critical in the event of clusters or outbreaks. For more information on communicable disease reporting requirements and documents, please contact your local health department, and you can also find additional information on the New York State Department of Health webpage for communicable disease reporting. Please see the slide of helpful links at the end of this webinar for that information. I'm now going to turn the presentation over to Bella Mazzetti, who will continue with outbreak identification.
Thanks, Gina. The Council of State and Territorial Epidemiologists provides guidance on outbreak identification that is also linked at the end of this webinar. According to the CSTE, given differing jurisdictional priorities, resources, school and school district sizes and structures, and varying levels of community transmission over time, one standardized numerical threshold for a school-related outbreak may not be suitable for all school settings. Schools may identify potential COVID-19 outbreaks based on cases or symptoms that are determined to be above expected compared to community levels. have concerning epidemiological patterns, have high levels of syndrome-specific or illness-based absences, have clusters, have high levels of transmission, or have SARS-CoV-2 infections which are impacting staff, spreading rapidly, or causing severe disease. Contact your local health department for additional clarity related to local response or definitions. Early identification and reporting of cases is a critical component of outbreak response, and is important to remember that reporting positive cases to your local health department provides an opportunity to communicate and address a potential outbreak. Please confer with your local health department to develop an outbreak response plan. Schools and districts and local health departments should confer and collaborate regarding the use of additional prevention strategies, such as wearing well-fitting masks or respirators, improving ventilation, screening testing, case investigation, and contact tracing in response to outbreaks or clusters. Now we will address some frequently asked questions about reporting. The first question is, should schools report all cases of COVID-19 or only the quote-unquote severe ones to their local health department? The answer is that schools should report all cases of coronavirus. This includes all cases of COVID-19, severe acute respiratory syndrome, and Middle East respiratory syndrome, regardless of perceived case severity. Schools are encouraged to contact their local health department regarding reporting of cases. Our second question is, should schools only report positive cases from tests that the school conducts? And the answer is that a school's responsibility to report COVID-19 cases pursuant to Education Law Section 906, Public Health Law Section 2101, and 10 NYCRR Section 2.12 may be dependent upon who is conducting the test and/or interpreting the results. If a physician or lab conducted the test, the lab should report the result to their local health department. However, schools may wish to report such cases as a precaution. If the school conducted the test, they should report the result to their local health department. If a student or staff member tests at home and discloses a positive result to the school should report the result to their local health department. And if the school suspects that a student or staff member has COVID-19, the school should report the suspect case to their LHD. Please confer with your local health department about this requirement. A link with contact information for each county health department will be provided at the end of this presentation. Some schools with LSLs may be concerned about the potential for repeated reports of individual cases to ECLAIRs and their local health department. There is intentional redundancy in reporting to make sure appropriate agencies can respond to public health needs in the community. Our third question is, should schools report all individual cases of COVID-19 or just clusters? Our answer is that schools should report every case of COVID-19, whether it be a single or multiple positive results. Now I'm going to pass it over to Christine Nguyen to finish our FAQs.
Thank you, Bella. Our fourth FAQ is, will the NYSDOH report card remain active? As previously mentioned, the requirement for schools to report daily COVID-19 testing and case-positive data to the NYSDOH pursuant to 10 NYCRR 2.9 ended on June 30th, 2022, and is not required at this time. Therefore, without this requirement, the report card website will no longer be active. On that same note, the last FAQ is, where can school personnel and families find NYSDOH COVID-19 data? Data on COVID-19 in New York State can be found on the NYSDOH COVID-19 website, which will be provided in a slide at the end of this presentation. Although the school report card and daily survey are no longer active, New York State continues to closely follow the COVID-19 epidemic across several data sources related to a variety of topics, including testing. For your convenience, all websites and links referenced in this webinar can be found on this slide and the next slide. With the links here, you can find information about reporting, including the forms used to report cases to your local health department. And here you can find some other helpful links, including information on LSLs, outbreaks, New York State guidance and data, and local health department contact information. As we conclude our webinar today, We want to thank you for your continued commitment to reducing the spread of COVID-19 and keeping schools open for in-person learning. And as always, if you have any questions, please feel free to email the New York State Department of Health Schools team at schoolquestionscovid@health.ny.gov. Thank you.